a few more minutes? Because at the moment there's only 25 participants in Zoom.
That's fine. Yeah.
Okay, thank you. Maybe students just finishing off their class. Okay, Assalamualaikum. Dr. Kamil, shall we begin now? I think quite a number, about 53 participants.
Yes,
Is
please.
that right?
Yeah.
Okay, Assalamualaikum warahmatullahi wabarakatuh. The Director of Ahmad, Associate Professor Dr. Hasrin Hassan, and especially Assistant Professor Dr. Kamil, from the Dean of Kuliah of Nursing. Okay. Okay, and sorry about that. And Associate Professor Dr. Ashikin Atan, Deputy Dean of Academic Kuliah of Nursing. Thank you very much for giving us your time. We are very fortunate to have you here with us. And this meeting is especially arranged for the meeting between Ahmad and the Kuliah of Nursing with the new pre-nursing students intake 2022. So Alhamdulillah, for this year, for this intake, we have about plus minus 160 pre-nursing students accepted into CFS IIUM. Yeah, Alhamdulillah. So far, this is the first time that we have a big number of pre-nursing students accepted into CFS IIUM. And because of that, I think and Department of Chemistry is responsible to ensure that the academic journey of these students are met, and we try our best to help them academically and to help them adjust to tertiary education learning. So that's why we invited you here, especially Dr. Kamil, because I think they have a few questions, yeah, especially about the nursing profession and what they are going to encounter first when they join Kuliah, and then after that, how about their career and their job placement and all that. So these are some of the questions that the students are asking. Yeah, and so it will be very helpful and will be insightful if Dr. Kamil can give us more information, yeah, about what the students are going to experience in Kuliah of Nursing, and maybe the clinical life after that, and career prospects after their 4 years of life in Kuliah of Nursing, inshallah. So I pass to Dr. Kamil, and to our dear students, please listen to Dr. Kamil, and we can have the question and answer session later after this. Yeah, thank you very much for your kind attention, my dear students. So let's give our ears to Dr. Kamil. Thank you, Dr. Kamil.
Assalamu alaikum and a very good afternoon. Thank you, Dr. Siti Fatimah, for such a kind introduction. Respected Director of Ahmad, Associate Professor Dr. Hasrina, colleagues at the Center for Foundation Studies, our Deputy Dean for Students for Academic and Internationalization, Dr. Ashikin Atan, and fellow students of CFS. I hope everyone is doing very well, and hopefully we are all safe from the COVID-19. Right, first of all, I would like to congratulate all foundation students for being accepted to our foundation program. And we are very grateful to have you around, around 160 students this time around. And hopefully you'll be a success and you will be have a better future and can join our Bachelor of Nursing program soon. The minimum requirement for Bachelor of Nursing program is 2.5 for your final CGPA. I'll be introducing what is a Bachelor of Nursing all about. We have a 4 years program. It is consists of 145 credit hours, where 20 credit hours is university core courses, and the Kuliah core courses is 125 credits. We are under the purview of Malaysian Nursing Board, where we have to abide all requirements by the Malaysian Nursing Board, MNB, or we call it in Malay as Lembaga Jururawat Malaysia, or LJM. We have to fulfill a minimum of 26 credits of clinical placement, or 52 weeks of clinical placement at various hospital or various healthcare facilities in Malaysia, or we have identified particularly at our Sultan Ahmad Shah Medical Center at IIUM or SASMEC, and also Ministry of Health facilities such as Community Health Center and our nearby hospital. In your year 1 or first year of the program, you will be taking all basic medical sciences courses, and also in year 2 you will be having 2 credits of 4 weeks of fundamental nursing practice, where you will be placed at our teaching hospital or our SASMEC for 4 weeks. After completing year 1, you will be having all medical surgical nursing courses in year 2. Our curriculum is mirror in a way that in semester 1, you will be having theory courses, and semester 2, you will be posted at clinical area. So for year 2, medical surgical nursing theory in semester 1, and you will have an 18 weeks of posting in semester 2. While in year 3, same thing again, we have specialized care nursing, where 2 departments will involve, which are special care nursing and also critical care nursing, will be teaching you the theory part for semester 1, and you will be posted to all specialized care area for nursing in year 3, semester 2. Beginning of year 4, you will be, the same thing, we will be having the theory part, but in year 4, semester 1, we have 4 weeks of clinical posting for management, where you will be assigned for different shift, including a night shift at our hospital. The final semester of year 4, or in year 4 semester 2, you will be having a final professional examination, where it is consists of theory component and practical component. The theory component include or integrated nursing courses, where you will be tested from the components or the theory that has been taught to you from year 1 until year 4, and the integrated nursing practice, where you have to go through again from year 1 until year 4. So these 2 courses will have one final professional examination. It is an exit examination before the end of our 4 years program. So you need to pass this final professional examination, then only you can sit for another exam set by our Malaysian Nursing Board for licensing. Yeah, so this final professional examination, we will have a few external examiners to observe you and also to monitor the flow of the final professional examination. And after completion of year 4 semester 2, you will be taking the our LGM examination or our Malaysian Nursing Board examination set by the Malaysian Nursing Board 3 times a year, usually in March, June, and September. So if you are joining our program in September or October next year, so your LGM examination will be, hopefully, inshallah, will be in September after 4 years of the program. In case you have to, the passing mark is 50. In case you did not manage to get 50 mark, so you have to wait for the next offered LGM exam. Usually, our passing mark is 100%, but then there are some of the years that 1 or 2 students did not manage to pass due to some reasons, particularly due to health reasons. So that's basically about your Bachelor of Nursing program. For your career pathway, previously we have 4 regular hospitals who came to us and interview our candidates, namely Gleneagles Hospital Penang, Sundabi Medical Center, where they have 3 hospitals under Sundabi. We have KPJ Ampang Putri, and recently we do have one from Thomson Hospital. So they came to us and conducted interview session for our graduating students, then offer them before they pass their final professional examination, they have already with them the offer letter. Either they want to accept it or they want to reject it. It depends on them. But many of our graduates accept the offer provided by these hospitals. Other than that, our students or our graduates are currently working at more than 98 institutions over the world. They are not only in Malaysia, but also they are all in Singapore, they are in Brunei, in Saudi Arabia, many of them, and also recently they went to Germany. Yeah, in terms of, in other hand, we do have our graduates also working with the Ministry of Health, where under the Ministry of Health or Kementerian Kesihatan Malaysia, KKM, they offer the post of jururawat U41 at time interval. So recently also during the pandemic, they opened the post of U41, and many of our alumni managed to secure the post. At the moment, we do have our senior, I think our first or second batch of nursing, where she is now promoted to a higher level of U41. I'm not quite certain whether she has been promoted to U48 or not. I will get in touch back with her. But many of our graduates now are promoted to a high level at Ministry of Health, Ministry of Health Facilities, or KKM. I would say that the Kuliah of Nursing, the graduate employability always more than 90% every year, where it is measured from the time of their graduation up to 6 months. So within this period, our graduates are being offered by many healthcare facilities. I think we could open more interactive way question and answer sessions so that it will be will be good for us, I think. Yeah.
Okay.
That's
Thank you, Dr. Kamil. Thank you very much. Now, yeah, like Dr. Kamil wished the session to be more interactive. So now I open to the students who are here in Zoom, and I will try and check the YouTube chat if there's any questions. Yeah, so please feel free to ask Dr. Kamil any questions that is bothering you at the moment. Yeah, because now Dr. Kamil is giving us his time, and he is the best person to explain to you about nursing education and nursing career that you are going to face in the kuliah, inshallah. Okay, I open to the all of you. There's about 60 plus students here. Is there any question? I'll check the chat box. No questions at the moment. That Dr. Kamil, maybe they are thinking. Oh, yeah.
That's right. I might want
Dr. Selina. Dr. Selina, somebody asked to change to law.
Yes, Dr. Selina, we are very lucky to have you here with us now. Yeah, some of them still thinking about the past. Yeah, but the progress of change of program, could you please enlighten us on that? If thank you, Dr. Selina, if you can.
Bismillahirrahmanirrahim. Rabbi shrah li sadri wa yassir li amri wahlul 'uqdatam min lisani yafqahu qawli. Ahlan wa sahlan wa marhaban bikum ila al-Jami'ah al-Islamiyah al-Alamiyah bi Malaysia. I would like to take this opportunity to welcome all of you to the Center for Foundation Studies. And thank you, Madam Siti, Dr. Siti, Dr. Kamil as the Dean of Nursing, Brother Izdihar, and I see here Dr. Mazni as well, lecturers and students. So coming back to the question posted before, I've expected this question in this session actually. As you all could see, everybody was given, everybody has seen your offer letter, right? And in the offer letter, it was stated that the offer is final. Am I right? I hope you can go through the offer letter carefully and read what is written in the offer letter. But somehow we have to entertain, a request to change of programs. Somehow the decision has been made and the opportunity has been given. And to those who are unsuccessful to be transferred to other courses, please stay put at the current program. And who knows, you have not explored yet your current program. And the interest might grow in the future or from time to time. As you go through the classes, the interest might grow and then your perspectives might change. Okay, So I would advise that every one of you would explore first what nursing is all about. Give some time for yourself, be fair to yourself to explore what nursing is all about. And inshallah, I'm sure you will enjoy nursing throughout your journey as a student at IUM. That's all what I can say for now. Thank you.
Prof, there is one question, Prof, additional question at the bottom
What is
there.
it?
It says that the student has email, but then they get no reply. Maybe you can add on that, Prof. We have the other day we have actually discussed on all the cases and through the system and COP.
Yeah.
Yeah.
Because
the student wondering why we didn't reply.
okay. Actually, we apologize for that. Because decision has been made, and that's why maybe our officers or our office didn't didn't reply the email because we thought that this case has been closed. I know the interest is still there, but we really hope that you will give yourself some time to explore what nursing is all about. As I mentioned earlier, please be fair to yourself as you have already accepted this program. Okay, so you have 1 year to explore what nursing is, and then you will have the opportunity to ask around, to ask the lecturers who are in the CFS, and you even ask the lecturers at the Kuantan campus. Okay. I think for now we would say that we don't entertain anymore any request to change of program.
Correct, Prof. Correct.
Thank you.
Correct.
I hope this answer is like substituting my reply to you through the email. Thank you.
Yes, correct. The rest is question on nursing though, Prof. Kamil.
Thank you very much, Dr. Hasina. Okay, Dr. Kamil, yes. Okay, one of the questions in Zoom. What can I do to pursue nursing occupation abroad? What are the requirements?
Be like Dr. Kamil.
Yeah, the one can get to work abroad, doctor. Yeah.
Yeah, the first thing is you need to be registered with our Malaysian Nursing Board or LJM. You need to pass the licensing examination. Once you've got the license, it depends on the place. If you want to work in Singapore, for example, so they just require the Dubai. All right. Yeah. So, for example, in Singapore, you can request through the either agency or directly apply to the hospital where do you want to work. Then they will request from us the few documents. Then you just register with their Singapore Nursing Board. If you want to work in Saudi Arabia, for example, they may need a minimum of 6 months of working experience. At the moment, I think they might change from time to time. Then you need, usually it will go by agency. There are many agencies working. There are many agencies that deal with the hospital over there, and we have many nurses working in Saudi. Then the same thing, you need to register, then have a minimum of 6 months experience. Then the agency will communicate with you and will liaise with the hospital over there. Then usually within 3 months, you can fly and be in Saudi. The same thing to Brunei Darussalam, I think. And if you want to work in Germany, they are requesting for a few documents from the university, and you can straight away go to that hospital. Similarly, like Singapore. So But if you are really interested to work abroad, we do have many alumni who are helping or facilitating their juniors to work similarly like them. Yeah, so I'm positive that they are more than happy to facilitate you in the future, inshallah. What else? Okay. Is it true that we cannot work under the KKM? As I mentioned earlier, we do have our graduates are working with KKM, so the question is, it is not true. So what else? Are we going to learn physics? And
No. They are not going to learn
No.
physics.
Physics
no.
and maths in kuliah. Are they going to learn physics and maths in kuliah?
No.
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 Only a foundation.
They might, yes, you might be learning how to calculate dosage of drug.
Yeah,
Okay.
application.
Yeah.
Application.
Application, exactly. Yeah, it's very straightforward.
Why
Become an
they are
official
very
nurse
scared to learn about
to.
Yeah, you all should
Sorry?
know. Yeah, they should be happy to learn maths, you know. I don't know why they are afraid to study maths and physics.
All right, but if they're interested, then we can offer a math class for them. If they're
Yeah,
interested.
why not? Actually, they are afraid, Prof.
Oh, afraid, but we do have statistics to be learned for
that's true.
research work. Yeah.
Definitely. Prof.
Yeah.
Jamal, Prof. Jamal, the
And-
expert.
Yeah, before becoming an official nurse, we need to take certificate. After completing your Bachelor of Nursing, after completing 8 semesters or 4 years of Bachelor of Nursing program, you will have to sit for licensing examination. It is not really a certificate, it's a licensing examination offered by Lembaga Jururawat Malaysia, so you need to pass it. Are we going to be hired directly to work as a nurse after finishing a
Worried to
degree?
calculate again.
Are we going to be hired? So
But
you will be hired from Ifa Shahira. You will be interviewed by the hospitals, by many institutions, by many healthcare facilities, and you might be offered by them. Then you can choose which place do you want to work. We do have, as I mentioned, we have more than 90 institutions where our alumni are working currently, including IJN, Prince Court Medical Center, Dialysis Center, you name it. What else?
If you want to work in Singapore, for example, do we need to work with KKM first? You need experience?
No, you don't have to. They don't need
Oh.
experience in Singapore. Yeah.
Oh,
But many of our brothers, our boys, the male, our male alumni are working in Singapore. Yeah. And apart from clinical, masters and PhD, where our alumni are also now a PhD holder in nursing as well. So there are a chance for you to further your studies. And apart from that, we have a specialization program, or if you are interested to specialize yourself in different fields, for example, in critical care area, in renal care area, in emergency care area, in midwifery, so you can do so with our kuliah. And also you can do it at any other institutions as well. after you have registered with a Malaysian Nursing Board or LJM.
When are we given the chance to choose in which department are we going to work at? Is it during degree or after we got the job?
Oh, right. Usually the hospital will ask you what is your preference. Yeah, so that they will assign you, or they will offer you at your interest area.
Oh yeah, Dr. Kamil. Yeah, you if they are interested, if the students are interested to work abroad, how about the agency? Do they have to look for the agency on their own, or maybe the Kuliah have the agency that are in touch with Kuliah?
Yes, we do have it is not an official MOU with the agency, but then we do have a few agencies that could help or could facilitate our graduates working abroad. Yeah, so it will be based on the previous experience by from our alumni, that it will be good if we work abroad through agency, because they will take care of our welfare according to them. Yeah, but for Singapore, it doesn't matter. It's our neighboring country, so it is very easy for us. What is this? Sakit betul means a real patient. Yes, we need to take care of real patients. Yeah. But during studies, it will be simulated patients and also real patients. Both. Yeah. Is it okay that students from art-based in school taking nursing, because it is hard to understand chemistry, biology? Malaysian Nursing Board accept those from art stream, but then they need to have a minimum of science in or at SPM level. So we do have some of our students are currently from art-based, but they are quite struggling in their first year of study, where they have to take all the basic medical sciences courses, namely microbiology, pathology, anatomy, physiology, biochemistry. But then, alhamdulillah, they did throughout the journey, they did quite well. And once they enter their clinical years, they are becoming better and better. Yeah. But in the first year, it's quite challenging for them. We do have a special class or additional classes for those who are in needs. How many subjects are we going to take in the degree? Oh. Approximately, we do have 7 to 8 courses in a semester. So if you do have 8 semesters, approximately 60 plus of number of courses. But then if we add in the university core courses or university required courses, it could be up to, is it 80 something? But the total credit hours is 145 at the moment. Is there any more questions?
So any more questions? Sisters and brothers? Nanti dah degree CGPA still 2.5. What is the passing CGPA for the final semester in kuliah, Doctor?
All right. Yes, we need to have a minimum of 2.5 at recent. I don't know whether our Malaysian Nursing Board has changed it, but as far as concerned, they did 2.5 before taking the LGM or Nursing Board examination. But then I can check again. But as far as I concerned, all of our graduates passed more than 2.5, and our current year 4. I think the minimum CGPA is 3.1 something, if I'm not mistaken. Yeah, there is no less than 3.0, because they are very good in clinical years. They are very good in practical courses where they can perform the nursing procedures very well. They do have their communication skills well, and they did. To me, they did well during clinical years.
Are we going to learn jahit? Are we going to learn jahit?
Yes, you will be taught of jahit the skin, right? You mean?
Yes,
toilet suturing?
yes,
Yeah, we will teach you how to do it, but then it depends on the institute or depends on the healthcare facilities where you work. In the future, if they require you to suture patients, then you can do. But if you are really scared of, we will make you familiarize with. Then it will you can bear with it. I'm positive. Yeah. What else? If you cannot pass CGPA, we will buy from CFS. We need a minimum of 2.5 at CFS to join Bachelor of Nursing program. If nursing okay. Can you explain about all the departments that we can work in? All right, there are various areas for nursing in general. Yeah, the first thing is I would like to explain at our SASMEC or our teaching hospital departments. Firstly, you can work at a medical surgical department, or you can nurse. You can take care of the adult, or we call it as adult nursing. Second one, pediatric nursing, or you can take care of the children. You can take care of the women's health, or you can take care of the pregnant mothers, for example. On the other hand, you can join the critical care areas where you can take care of the intubated patients. You can take care of those who are having cardiac, who require intensive care of cardiac. You can intensive care of a newborn, for example, and you can also work at the emergency care, if you like, emergency and trauma cases. You can work at where else? Many more places in the hospital. For instance, you can work at the radiology department if they have a post there. You can work at the clinics. You can work at the family health clinics. You can work at the dialysis center, the dialysis unit. Yeah, many places you can work. And also, if you are working with Ministry of Health, you can work. Yeah, if you like to join the community. What else? if we are graduated, what position will we get? What position?
In the government
what do you mean
hospital,
position?
Dr. Kamil, maybe
Oh,
the
the
grade.
government hospital.
I guess maybe the grade.
Yeah, if in government hospital at bachelor's level, you can, the position is, they call it as Jurawat U41. Or during my time, they accept for those with bachelor's degree to become their tutor, and then they will send these new tutor for their clinical placement before being appointed as tutor. They give clinical exposures to them, but at bachelor's level, the position is U41 for clinical posting. Are we going to handle it by ourselves, or the university will place us themselves? During your clinical years with us for Bachelor of Nursing program, you will be assigned to all designated or all places or all areas determined by our Malaysian Nursing Board in group. Then we will assign clinical instructor or our nurses to observe you, to teach you, or to guide you at clinical areas. Then if you did, and our lecturers are also will be with you for bedside teaching and assessment. We will inform that we can drop one core subject for this one is for foundation, right? From
That's for foundation, I think. Yeah, I mean because we are in the process of making easy for the students to manage, especially the arts-based students. So we plan out their study plan so that it will not be a burden for them, especially taking the core courses. Yeah, that's I think for CFS questions. Okay.
right. Oh, don't want to take care of children. That's fine. You can choose. You can take care of older people. You can take care of adult. When we are going for practical, did the uni will place us automatically, or we can choose it? Yes, you will be assigned by rotation. All places you have to go according to the requirement of Malaysian Nursing Board. This is for CFS. Does we need to learn by ourselves during the extension?
Oh, of course not. You have your classes. Don't worry about that. We have your classes. Okay. Veterinary doctor?
Is it?
Continue. I've heard that we can continue in veterinary. Is it true? Vet nurse, a veterinary nurse.
Oh, we are dealing with caring human being. If you want to change your career to be a vet nurse, I think should be fine, no problem. Vet nurse, right? But we don't teach caring animals. But if you are interested, we do have our frozen zoo dealing with animal by our basic medical sciences for nursing department, where we do have taking care of animals such as rabbit. What else? We don't have pangolin. We do have. We have many more wild animals, I think. Yeah.
So is it?
Frog. Yes.
No, what I mean the animals. I mean taking care of the animals. Is it part of their curriculum, doctor?
No. Taking care is optional. Oh, okay. Yes, if you do, if they like, then we can arrange for them. Can nurses work in forensic area? Yes, we do have one our academic trainee who has completed his PhD in forensic nursing, and we plan to have elective for forensic and masters of advanced nursing practice in forensic, inshallah, in 3 years' time. So yeah, if you would like to have to work in forensic area, by all means, we can expose you by providing elective courses that you can request for, yeah, while joining us. 1 to 10, how easy to get a job as nursing graduation? If 1 is difficult, 10 is the easiest, I would say 10, because we need more nurses to cater the healthcare facilities in Malaysia. We have growing numbers of healthcare facilities or hospitals or institutions in Malaysia. Therefore, we need more nurses. So those are the university, those are the hospitals that came to us before they required bachelor's nurses. So that's why they always, every year they come to our place, and they wanted the I think the cream of the cream, I think. So that's why they came ahead, they came ahead of time from other hospital. Right. How many graduates will get job? Is it all or like 85% to 90%? I would say that our graduate employability within 6 months is 100%, but then some of our graduates also are not interested to work once they they have their family and they don't want to work. So it depends on the individual. So yeah. When I can choose position untuk nursing ibu besar. Oh, you mean midwife? Yes, you can be a nurse midwife after you registered with, after completion of bachelor's degree. Then you can you have to work for a minimum of 6 months, I think, at respective areas. For example, in maternal ward, then you can pursue your study in either advanced diploma in midwifery or postgraduate diploma in midwifery, or master of advanced practice in midwifery to become a registered nurse. You have to take another examination offered by Malaysian Midwifery Board before become a registered midwife, so that you can be a midwife. You can involve with all those maternal and newborn. Right? If
can a
someone
nurse
works
become
as
a doctor?
can
Can a nurse become a doctor?
A medical doctor, you mean?
Medical doctor, yes. Medical doctor.
Yes. If you want to be a medical doctor, you have to attend a medical degree. Yeah. So there was one of our alumni, I think, take another degree in medicine. So yeah, to become a doctor. But after a bachelor's program, you can be whatever you like. I don't know whether, I think you can be a lawyer as well, but you have to attend a lawyer's program, for example. Yeah. Can diploma students go straight up working without having degree? For diploma in nursing students, currently under Ministry of Health, they can work as a nurse, U29 at Ministry of Health, for example. Yeah. So as long as they registered with Malaysian Nursing Board, they can work. Yeah. After degree, if you want to continue our study to master, we need to do 4 years. Okay, if you want to do your master's by research, you can do so after completion of your degree. In fact, we have many of our graduates doing masters with us after completion of their 4 years of degree. So they are doing masters by research. But if you want to specialize, you want to do masters in advanced nursing practice, for example, so you need to have a certain amount of clinical, where I think the requirement is 2 to 3 years of clinical experience before joining the masters of advanced nursing practice in specialization, either renal care, orthopedic care, wound care, critical care, emergency care. There are many more, yeah, or forensic nursing. Can I be lecturer in UIA after graduate? In order to be a lecturer at IUM, you need to have a PhD, so preferably PhD in nursing, so that, yeah, of course you can. Currently, we do have 2 of our alumni, batch number 3, completed their PhDs and joining us now. Yeah, Dr. Firdaus, Muhammad Ismail, our lecturer, is our alumni. Dr. Siti Zuhaida, our alumni. Did we need to repeat our foundation if we don't pass the target? Yes. What is the practice at CFS?
It depends on their CGPA, doctor. They have to they have like minimum 2. Minimum is 2.0 actually, but then then again, to go to certain kuliah, they have to fulfill the requirement put by the kuliah, right? For example, like nursing, they have to pass 2.5.
Right. Okay. So if we graduate with degrees, so our positions in hospital. Oh, right. The position, I'm talking about government hospital. If you have bachelor's degree, they will offer you U41. And if those with diploma, the salary grade is U29, where if you ask me, the salary is higher. It is based on your qualifications. But then at a clinic, at a private hospital, so it depends on the private hospital. I worked in a Prince Court Medical Center before, and we earned higher salary as compared to those who has not a bachelor's degree. And at that time, they call nurse with bachelor's as clinical nurse, and those with diploma, they call it as a staff nurse. It depends on the institution. It depends on the healthcare facilities. Yeah, I'm not quite certain now, and I've heard from our graduates that they earn a bit higher as compared to others. They earn additional, for example, additional allowance for. Yeah, it depends on the healthcare facilities. What the difference between nurses that graduated degree and diploma? Yeah, if you talk about differences, they have a similar nursing care skills, where because they have a minimum of 52 weeks of clinical posting, but then for a bachelor's degree at I'm talking about a government hospital, they have some skills that require bachelor's degree, where many of our graduates involved with research at hospitals. So there are certain components that cannot be performed by diploma nurses. Yeah. Is it nurses in Malaysia contract same like the doctors? Oh, I have to check this. I can check with our recently appointed graduates. Yeah, whether they are permanent or they are contractor. To children. Oh, of course, you will have some time for you yourself. You can enjoy your life while doing a bachelor's degree. Yeah. Of course, we are taking care of your welfare and also mental well-being, particularly during this pandemic. Yeah, don't worry, inshallah, you will be fine. Oh, 1 to 10, how much chance to get work as a nurse in government hospital? I can't say really. No, in 5 years' time. Let me recall. Let me recall the last year during pandemic. He's from the batch. He's graduated in 2016, and he's got the post last 2020. Inshallah, just pray days and night. If you are interested to work in government hospital, yeah, you will get the chance, inshallah. Yeah. Is that right? Who has greater chance of getting a job? This is that graduated with degree or diploma. I don't know if I am the if I am a patient, I would like to be nursed by a bachelor's degree nurse. Yeah, because World Health Organization recommendation a minimum of a bachelor's degree in order, towards being a developed country. Yeah, like Singapore, they are currently a minimum of bachelor's degree. Thailand and also Indonesia towards that. Yeah, so we are following the recommendation by World Health Organization. Right.
Okay, any more questions, brothers and sisters? Can doctor tell about life after graduate, which of nursing, like the practical of getting a job? Is it easy to get a job after graduating? Any advice from Dr. Kamil?
Yes, it is. I think it is easier than you think, but it's up to you whether you want to choose it or not. So you can choose basically. So either hospital A, B, C, or D, you can choose. You might have I presume that you might have many offers from various hospitals.
Okay. Any advice from Dr. Kamil?
Advice on what? On
You have to answer that, doctor.
when the best age for
Please
nurse to
message.
get married? I might get advice from, I don't know, we don't have any research about this, I think. But then I can't answer it. Yeah, I'm sorry. When the best age for nurse to get married? Is it different with other professions?
Doctor, maybe they are
sorry.
concerned. Maybe they are concerned with the hours spent at the hospital, doctor. You know, maybe how many hours does a nurse have to work? You know, in the hospital, is it 8 hours? More than 8 hours? The shift maybe.
All right. Okay. So yeah, if you're working shift system, so it will be if we have day, afternoon, and night shift, for example. Yeah, if you're working day and afternoon shift, morning and afternoon shift, so you have to work 6 days a week, or one shift is 7 days, 7 hours, one shift 7 hours, and 6 days per week. So it is 42 hours per week. So it is counted as hours. When I was in Prescott, they count it as 45 hours per week, if I'm not mistaken. So we work 7.5 hours per day. accumulating to 45 hours. So it depends on the hours. So, but if you work night shift, it will be 10 hours from, currently it's 10 hours from 9 to 7. Then after 2 nights, you will have 1 day off. So basically around 40 to 45 hours per week, yeah, working time. But then many of our graduates like to work extra hours because they earn more, you see. They call it as maybe locum. So if you work extra hours, then you will have the money but you might not have time. So that's the thing. But yeah. So what else?
They are worried about jodoh, doctor.
You have to what we call that one. Jody is under God's purview, right? You don't have to worry. Is anything else? If you wanted to take bachelor in nursing, we need to work for a few years. What does it mean? After your foundation program, so you have to get to 0.5 and joining our bachelor's degree, our bachelor's program. Yeah. All right. Is there anything else?
Okay, I think Dr. Kamil has answered most of the questions. We go to talk about nurse job. Like I said, maybe nurse job, doctor. They can be offered, right? Offered if they are successful at the interview, they will be offered immediately, right? Even before graduation, right? Like you mentioned before, yeah.
Exactly.
Dr. Kamil has mentioned before, yeah.
Yeah.
Okay, I think we are approaching to the end of our session. My dear students and Dr. Kamil and also Madam Director Dr. Hasina and our Dr. Ashikin. How about Dr. Ashikin? Would you like to say anything to the students, maybe motivate them, Dr. Ashikin? If you, Dr. Ashikin is the Deputy Dean of Academic and Internationalization, right?
Yes, I am.
Yes, Dr. Ashikin, if you'd like to say or advise the students.
Assalamualaikum, everyone. It's a pleasure for me to join you this evening. And I can see that a lot of questions being asked and being answered by Dr. Kamil. And I believe that Dr. Kamil's already covered most of the things. And I just wish that I will see you in 1 year time, hopefully, inshallah. Just have a great time at CFS, and we will continue your great time at Kuliah of Nursing too, inshallah. All the best, everyone.
Thank you very much, Dr. Ashikin. Thank you very much. So I think we can continue we can end our session, but basically I think Dr. Kamil has covered or has answered most of the questions that are actually asked by the students. Mostly are concerned with career after graduating from the kuliah, right? So as you have heard yourself from Dr. Kamil, inshallah, with the dedication that you put into your study, inshallah, you will get the career that you want. Inshallah, your career path will be very clear, inshallah. So basically, if okay, one last question, doctor, if I may. What do you think is the okay, other than academic excellence, what do you think is the characteristic that is very important to have in a nurse, to work in the nursing profession? What is the characteristic? Maybe the emotional side and all that, besides the academic excellence, of course. But what do you think is very important? Yeah, to face the reality of working long hours in the hospital, facing many different type of patients in different conditions and all that. What do you think is the more important characteristics? The characteristics. Yeah.
I would say the passion of caring people is the most important thing. Yeah, so the interest could be developed throughout the years. Yeah, so if you have the notion of helping other peoples and you think it is a good deed to be practiced, then inshallah we will get reward from Allah Subhanahu wa Taala. Yeah, so the passion is very important, I think. Yeah.
Passion for caring. Yeah, thank you, inshallah. Yeah, because as you know, I think in a hadith, if a person cares for a sick person, inshallah, Allah will Allah's blessing will be following that person. Yeah. And in fact, I think the professionals in the medical profession, nurses and doctors, they are very lucky in the sense that Allah's blessing is always with them. Yeah, because I guess it's not easy to care for patients in hospitals, right? Because I say that from my own experience, not my own experience. I mean my siblings. I have 4 doctors in the family, and also I have cousins who are nurses. And of course, you need to be really dedicated and really have the passion to care, like Dr. Kamil said, to care for the sick, inshallah. And then if you have you are aware that you are doing that with Allah's help, inshallah, Allah's blessing will be with you, inshallah. And with that, I also pray that your journey in CFS, inshallah, will be easy, and inshallah, you will be successful also in your journey in the Kuliah of Nursing, inshallah. You are lucky that you have dedicated lecturers like Dr. Kamil and Dr. Ashikin, who are willing to actually give you their time here this evening to explain to you about nursing and nursing career and the prospect of the nursing career, inshallah. So with that, let's end our session. Tasbih Kifayah Sawal Ars, and I will really express my thanks to Dr. Slina, Dr. Kamil, and Dr. Ashikin for being with us, and of course to our dear students who also are with us at the moment, and also the heads of department of biology and maths department also, and our brother Dean, Deputy Dean Badi Izdihar. Thank you very much for your presence. With that, we'll end the session. Thank you, everyone. Assalamualaikum warahmatullahi wabarakatuh.
Thank you, everyone. Stay safe. Have a good weekend.
Thank you, everyone.
Thank you, Doctor.
Amin, amin ya rabbal alamin.
Thank you, Doctor.
Thank you, Doctor.
Thank you, Doctor.
Thank you, everyone. Assalamualaikum
Thank you,
warahmatullahi wabarakatuh.
Thank you,
Thank you,
Madam.
Madam. Thank you, Doctor. Have a nice day.
Oh yeah, all okay. Good night.
Good night.
Evening. Take care. Okay. Assalamualaikum warahmatullahi wabarakatuh.
Aku salah. Mak.